Good evening, everyone, ladies and gentlemen, and our esteemed guest, Dr. Dayal Mirchandani. We are delighted to inform everyone that the Academy of Hypnosis is officially 1 year old now, and it has been a beautiful journey. We have had so many sessions, and so many people have encouraged us in our journey, and we have received guidance from uh, very renowned people from the industry. Dr. Dayal has always been there as a pillar of our strength. Dr. Bhupendra Palan, our president, his guidance has constantly been with us. Dr. Rakesh Jain, our vice president, he is the mind and eyes of Academy. And we are very happy to celebrate this occasion with all of you. And I would now like to invite President of Academy of Hypnosis, Dr. Bhupendra Palan, to start the official function. So, please.
Thank you, Nidhi. Good evening to all of you. Welcome.
Good evening.
I'm extremely happy that we could start this academy, and 1 year was full of activities, and everybody is very enthusiastic. Our management committee members and our members who joined AOH. So I can see that there is a lot of motivation and enthusiasm among all of us, and I'm very happy about it. I welcome all of you for this celebration of first year completion of Academy, the Foundation Day celebration. And when we started on 26th of June 2022, I really was not expecting that we'll be conducting such a big and such a very successful conference. So in February this year, we could conduct that international conference. And every month we have been able to do clinical meetings. So these are the two major activities. Plus, we have in pipeline several programs for this year also. And one more thing which happened is we could create a newsletter. And I think all the management committee members, all the contributors, but especially Veena, who, in spite of her several engagements in those days, she could devote her time and created a newsletter. The first issue is going to be inaugurated today. Especially, I welcome Dr. Dayal Mirchandani for accepting our invitation to be present on this occasion and accepting the invitation for release of the first issue of our newsletter. Of course, Dr. Dayal Mirchandani is our advisory committee member also, and we have been constantly receiving guidance and support from him. So I welcome once again all of you, my management committee members, my students, and all the participants who want to join today's workshop, who have come to join today's introductory workshop. Welcome again. Thank you. Thank you very much.
Thank you so much, sir, for this lovely welcome. I would now like to invite Vice President of Academy of Hypnosis, Dr. Rakesh Jain, to give us a brief introduction about the Academy. Sir, please.
Thank you, Nidhi. Our esteemed guest, Dr. Dayal Mirchandani ji, President of the Academy, Dr. Bhupendra Palan, our part of the Academy, Dr. Alok Prappna, Dr. Veena, Dr. Prasanto, Dr. Santanam, Tejveer, Dr. Avnish Dave, the Secretary, Dr. Chandarana, and all the participants, dear participants. In fact, the journey so far has been quite pleasant and thrilling. So I would like to recall how the idea of Academy of Hypnosis originated. In 2021, we had a conference of Indian Association of Clinical Psychologists. It was a virtual conference. So we proposed a symposium on hypnosis in the conference. It was a very good conference, a huge conference, well organized. And Dr. Prasanto, Dr. Ginny, and me, we three proposed a symposium. And when the organizing committee consulted me regarding who should be the chairperson of the symposium, I advised them that Dr. Palan is the only person who can guide us in the symposium. And the organizing committee accepted my suggestion, and Dr. Palan readily accepted our request. He joined us as chairperson of the symposium, along with Dr. Kaptan Singh Sengar. The symposium was over. Then after the symposium, then we started contemplating, why don't we have our own association, our own academy, so that we professionals of hypnotherapy, we are lacking an organized association of professionals, so we can have an association. We started deliberating upon it in 21, and in 22, finally, we got it registered as a trust. And on 26th of June last year in 22, we inaugurated our academy, and we invited international guests to on the occasion. They spoke very well, both the international speakers, and we also invited the then president of Indian Association of Clinical Psychologists and chairperson of the conference of the Indian Association of Clinical Psychologists, and along with other members and participants, we inaugurated on 26th June, and this on 24th and 25th, we are celebrating our 1 year's journey, and this journey has been full of activities. We could organize an international conference with many international speakers. It was a very good conference organized in Vadodara, and still people appreciate it. And the guest of honor whom we invited we got a new channel through him, and he still remembers, and he quotes at many platforms regarding our conference, the way we organize everything about the conference. And apart from that major activity of the conference, we conduct a regular monthly clinical meeting in which the professionals of hypnosis, those who are working in hypnosis, they present their cases. It's a wonderful experience for all of us, a learning experience. We learn a lot through our clinical meet. And in this series of it, we'll be releasing our first newsletter after a while. And we have also formulated various categories of membership to our academy, professional members and other kind of memberships. It is available maybe through website. I think it is available on the website, the class of memberships. We launched a website of Hypnosis Academy of Hypnosis.in. We hosted this website in this year, and Dr. Prasanto told me, I was thrilled by his revelation that the International Association, with the criteria we adopted for our members, it is accepted by international society, and they are advising others also that this kind of criteria should be adopted for professional members. And we have developed a curriculum of training of professionals for 60 hours, through which, after completing that program. We'll be launching very soon the formal training program to the professionals. After completing those persons who will be completing that course will be eligible to have professional membership of the academy. And regarding hypnosis, I think in India we are just still we are in the beginning stage, in fancy stage. We have to reach our heights in coming years, and you will come to know through this workshop, because there are so many myths attached to hypnosis, both in professionals and laymen. So this profession has not achieved its rightful status because of many misconceptions. I am really convinced that hypnosis is very useful in both illness and wellness, to promote positive qualities as well as to reduce the suffering of the individual suffering from various kind of medical disorders. Not one, there are many. So hypnosis can be applied. You will be knowing today the uses of and applications of hypnosis. It is a huge application. The magic, some kind of that myths, it's some kind of magic, myth, some mystery behind it. It is a scientific activity. Hypnosis is a science, a legitimate science. It can be studied scientifically, and it can be learned by any professional with the right attitude. And I think with this academy, we shall be able to deliver our best to the society and to the profession. With this, I welcome you all and thank Dr. Dayal Mirchandani for accepting our request to be our guest today, and to all the members of the academy and the participants. Thank you very much.
Thank you so much, sir. Now we start with inauguration of our newsletter, and to inaugurate this, we have invited Dr. Dayal Mirchandani, who is also one of the advisory board members. To introduce him, who better than the editor of newsletter of AOH, Dr. Veena Punjwani. Ma'am, please.
Thank you, Nidhi. I welcome you all to this inaugural day function today, and I'm still searching for words to introduce Dr. Dayal Mirchandani, being such a stalwart personality that he has been. And I still remember when I was in my school days and I read one article in Reader's Digest at that time. It was written on therapy, journey of mind and hypnotherapy, Dr. Dayal Mirchandani. And at that time, I was so curious of what this is and what kind of work this is, and how a direction can be given to something which changes people's lives. And the turn that life takes, today I'm here getting this opportunity to speak a few words for his introduction. Dr. Dayal Mirchandani has done MD. He has been practicing psychiatry from 1980 till March 2020. And that is not even in my lifespan. It is more than that. And he has been a member of Board of Studies for 3 different universities, TISS, SNDT, Mumbai University. He is also the founder of Behavioral Science Foundation, India, and he has been actively involved in training and therapy in the field of psychotherapy and hypnotherapy. At present, Dr. Dayal Mirchandani is a visiting faculty for hypnotherapy at the Charusat University program in hypnotherapy, and he is also the author of Healing Heart Disease Naturally, and also Super Performance Learning. And he has published these books, and he has also co-authored books on group therapy for addiction and manual for prevention of addiction. He has been invited for several conferences and training programs across India and also abroad. And with this, I would like to invite Dr. Dayal Mirchandani to please release the newsletter, sir, and have your guiding words for us.
Thank you, Dr. Punjwani, Dr. Veena. And thank you all of you for inviting me, the managing committee. And I'm really happy to see that there is a professional hypnosis body growing now. Till now, we've had a lot of lay hypnotists, but they gradually have lost their, people were very interested. There was a big kind of explosion of lay hypnotists in Bombay and other cities, but now I find that hardly anyone is, the lay hypnotists are kind of dying out. Even though they are trained, they are not practicing or not getting, because many of them are crossing lines which were not, they were not capable of dealing with severe illnesses, or they did not maintain some kind of ethics of only treating what comes within the scope of their practice. So coming back to hypnosis, I see a huge future, because if you go to any GP's practice, about 20% of people will require some kind of behavioral intervention, and nothing better than hypnosis for that. Stress, hypertension, smoking, childbirth, all kinds of medical issues. Then, of course, you have the people who want painless childbirth. That itself, you can make a, it can make a great difference to people. You can, I mean, I've seen people who even increased lactation in women who were not able to lactate properly. Fears, anxiety, all kinds of things. And then there's sports. I've seen people doing hypnosis for sports, hypnosis for management, people in management, to help them deal with stress, become better managers, enhancing their leadership skills. So there's a huge opportunity for young hypnotists or hypnotherapists to expand their practice in an ethical way. And I think as a first step towards this, a newsletter is great, because it I've seen the copy of the newsletter, so it gives you a kind of idea of the case studies. There are articles by experts like Dr. Palan on introducing hypnosis. There'll be new articles, I'm sure, and there are case studies which will encourage others to use it in different ways. Dr. Roy has written on recent advances in hypnosis taken from other journals. So this will increase the knowledge and interest in hypnosis and give guidance on how to expand your practice in new ways in different areas and keep you active. And it will also encourage a sharing of information between members. I'm sure that if there are meetings or other things happening within the country, those will in due course be also published. So it'll be a great thing. And plus, if it's put up on the website, people will read about it and maybe be attracted towards coming to the authors and that kind of thing. So it will help in the growth of ethical hypnotherapy. So I'm really happy, and I really congratulate Dr. Palan for all the work he's done over the years. I first met Dr. Palan in 1984, I think, at a conference, and it's been a long journey. And I'm glad that hypnosis will have a safe future in the AOH. So with that, I thank you all again for attending today and for inviting me. I hope that from the newsletter, it'll go to a journal too. I mean, both journal and newsletter, and maybe other new things which you can't even foresee given AI and all kinds of things coming up. Thank you all.
Thank you, Dr. Dayal. And Nidhi or Veena, you may like to show the newsletter,
Yes,
please.
sir. I'll share the screen. Veena ma'am, if you want to speak something about it. So this is the first edition of our newsletter. It will be made available on our website and will be shared in our WhatsApp groups as well.
Veena, you may like to share something, your experience of creating this wonderful first issue.
Yes, sir. So this newsletter has some constant columns like from the Bodhisattva, case illustration, new and trending, and the in vogue, something which is there in recent observation. And I would request the practitioners, researchers to come up with the wonderful work that they are doing, give it a structure, and please submit them for the publication. Nidhi, if you can go up one page more. Yes. So there are going to be sections on event update from the Bodhisattva, feature article, case illustration, in vogue and rising, and new and trending.
Very nice. Anything
Thank
further,
you.
Veena? Thank you.
I just hope that everyone has good experience reading. Thank you.
Congratulations. Very good.
Congratulations to Dr. Veena and to all the Academy members on formal release of our first newsletter. It's a great milestone for us.
Really, yes. Thank you, Dr. Dayal, once again.
Thank you again. It's been my pleasure.
So going forward, as promised, we would now start with the basics of hypnosis workshop. And this workshop has been divided into certain segments. Each segment will be taken by one of our senior esteemed members of Academy of Hypnosis. And the first topic that we are going to cover today is the introduction of hypnosis and its history, which will be covered by Dr. Rakesh Jain. So please.
Rakesh, just a moment. I request all the colleagues to see the timing. We are already little delayed. So adhere to your our timings, what we have decided, 15 minutes. I'm telling to myself also, because I also tend to go beyond that. So let us all look into the time and complete our presentation in 15 minutes, so that we can complete the workshop in time. Please, Rakesh, please.
Yeah, thank you, sir. So, dear participants and learned professionals, senior professionals. So, it is said to be history of hypnosis. But for me, I think it is history of formal recognition of hypnotic phenomena instead of hypnosis. Because hypnosis is a natural state of awareness. It existed as and when there was an origin of human being, the mind, it was there. It existed then and there. It is an integral and essential part of the awareness, the mind, the neurophysiology. Then how we came to recognize this phenomena, that is the history. How did we recognize? How did we formulated ideas, our conceptualizations, our theories, the mechanisms of hypnosis? That is the history part of it. Whatever our literature says, the recorded part of it, it is recorded that in ancient time, in Rome, Greece, even India, there were sleep temples. Sleep temples means there were priests in the temples, people with suffering, illness, they used to visit those temples. The priests over there, they were putting those patients into sleep and maybe giving some kind of suggestions. And these sleep temples, also healing temples, healing was taking place. Only a little bit of it is known of that time, about sleep temples, they are functioning, but it was certain that people were visiting there, priests were taking them into sleep. They were calling it sleep. It's not in fact a sleep. So they were taking into sleep and they were getting therapeutic benefits out of it. And if we look into our epics, so I remember that in Ramayana, one very vivid instance, I remember that when Hanumanji visited Patal and had to overcome Makardhwaj, his own son. So he used Mohini Vidya. What was that? I think it was also hypnosis. That is there. But when we come to there's documentation, proper documentation in the name of hypnosis-like phenomena. So sleep temples were functioning for a long time, and then at that time there was not any recognition of existence of conscious mind, subconscious mind, and unconscious mind. These concepts were not developed. So then comes directly we jump to the Mesmer. Mesmer was a physician. He somewhere on stage observed a phenomena which was hypnosis-like phenomena observed on the stage, and then inspired from that phenomena, he formulated his own concepts, his own ideas. He conceptualized that hypnosis, he was not using the term hypnosis, he was using the term animal magnetism, a kind of magnetism. It's not a physical magnet, but some kind of magnetism. So subtle fluid, they say, it's a subtle fluid. And it circulates, it vibrates throughout the body. And if there is a blockage in that fluid, it causes illness. And the person who knows about animal magnetism, how to do it, he can unblock that obstructions and people get healed. He was practicing like that with the concept of animal magnetism. He had very good students also. Pussiger is one of them. So they were using, there were some disputes in Germany. He had to be expelled from Germany and he settled in France. He started practicing there. Again, there were some disputes. In fact, I admired him. He was a very scientific person. He was offering a research project to the university that we can conduct a randomized controlled trial of hypnosis. Oh no, I'm using the term hypnosis, the animal magnetism, but it was not granted. Because the mechanism of therapeutic benefits, whatever his patients were receiving, it was not very clear, very obvious. It was not being explained properly scientifically. So a committee was set up to inquire into the functioning of mesmer, particularly magnetism. The committee consisted of very learned persons, renowned persons, well-established medical and different scientific disciplines. The committee inquired about existence of magnetism, animal magnetism, the subtle fluid. The committee inquired, talked to the patients, talked to Pussiger, and somewhere I read that committee did not talk to Mesmer. Maybe it was mentioned somewhere, then the committee concluded two things. And both the things are very important. Number one, the report says that we did not find any evidence of animal magnetism, subtle fluid. Number one. Number two, what were जो भी therapeutic benefits what were being achieved in the patients, they were an act of imagination. And based on this report of the committee, mesmerism was banned. And later on, we recognized that the committee was very sharp in its observation. They very rightly pointed out that it is an act of imagination which can be achieved through suggestions. It was already recognized at that time by the committee, but that part got ignored. The only emphasis was laid on the presence or absence of animal magnetism.
Progress.
Since mesmerism was banned, it was not being legally practiced. Then in Scotland, there was a surgeon, James Braid. He came up with certain physiological explanations. He stated that it is a physiological state. If one stares on a bright light, one can pass into that state. He used some typical words, but which is translated as hypnosis. Hypnosis, the term became popular. He is called the father of hypnosis, James Braid. And then after James Braid, people started exploring and practicing. The leading schools of hypnosis, they were in France. One is Jean-Martin Charcot. He was a neurologist. He was a true genius. He did many inventions in neurology. He was having this physiological explanation. It is also said that he was having an opinion that hypnosis is a pathological state. But I don't think it's a pathological state, it's a physiological state. He was treating patients of hysteria. Patients of hysteria, we know that they land up in neurology clinics, many of such patients, because they have convulsion-like phenomena, dissociative convulsions. They go to neurology departments. So in neurology, the Charcot was treating the patients with hypnosis. And about 14 kilometers from Paris, there was another school of hypnosis, popularly known as Nancy School. In Nancy School, Liebold, Hippolyte Bernheim, they were practicing hypnosis based on the idea of suggestions, suggestibility. The idea of suggestibility, its origin is very interesting. In Goa, there was a Portuguese family, and there was a person called Abbe Faria. In his teenage, he went to Paris, and it is said that his father was practicing self-hypnosis. He had some ideas about hypnosis. He interacted with Pussiger also. And then he had that explanation that the method of animal magnetism, the passage, the fluid, metals or whatever, though nothing is required, hypnotic state can be achieved through suggestions. He was having that conception, and that was followed at Nancy School. And then came the Sigmund Freud. Sigmund Freud was a physician, medical professional. He studied with Charcot, also observed the work of Liebold. Up to that time, there was no psychoanalysis, only hypnosis, hypnotherapy, either physiological explanations or psychological explanations. It was going on. It was a simple level of treatment of suggestive psychotherapy, I think. So Sigmund Freud learned about hypnosis. He started practicing hypnosis. But during the course of his treatment, he came up with some other techniques. He developed his own ideas that the access to unconscious mind, what we call that through hypnosis, we can access the unconscious mind of a person. So to access the unconscious mind, there can be alternative techniques. So he discovered free association techniques. Based on free association techniques, he developed his entire psychoanalysis, which influenced the world in psychological treatment. So after hypnosis, there was birth of psychoanalysis. And psychoanalysis has its root in hypnosis only. So Sigmund Freud favored his own procedures, free association, his concept of transference and resistance. He favored that, developed psychoanalysis, started treating the patients with psychoanalysis instead of hypnosis. And psychoanalysis became quite popular, influential, and hypnosis was sidetracked. After a few years, the learning theories, the participants, those who are in psychology, they must have heard of Clark Hull, C.L. Hull, the learning theories. Clark Hull conducted laboratory experiments on hypnosis and developed his own theory of dissociation. That it is a state of the key feature of hypnosis is dissociation. It's a very good theory. Still, we are following in some form dissociation theory. There are, of course, some advancements in his concepts, but the idea of dissociation, he established that idea of dissociation. And in one genius, Milton Erickson, was his student. He learned from Clark Hull, and he performed series of hypnotic procedures, and he had a very good relation with Clark Hull. And Milton Erickson, we call it father of modern hypnosis. And I am convinced that without studying Erickson, we cannot understand hypnosis, we cannot practice hypnosis effectively. So those who are interested in the field of hypnosis must read Milton Erickson. So Milton Erickson established Hypnosis Association, then started a American Journal of Clinical Hypnosis. He started that, and his approach is a unique approach. Those who know about neuro-linguistic programming, the neuro-linguistic programming is based on Ericksonian approach. And from this work of Erickson, we started practicing hypnosis, and it spread like anything after Erickson's. And then coming to India, since time is short, I takes about 2 hours to share my ideas about history. So just one more minute I may take. So in India, so the starting of diploma courses in MSU University, Baroda, and then later on Charusat by Dr. Palan sir, and we are having those legends here, those who are involved in MS university programs, and Charusat by Dr. Palan, contact learning program, diploma program. These are the formal programs, as Dr. Mirchandani has rightly said, that lay hypnosis and professionally trained hypnosis, we can have a bit distinction. The professionally trained hypnosis, we consider those who have acquired this diploma formal qualification in hypnosis, those who have properly supervised training, scientific training, and the upcoming training we will be launching through Academy. And now we are seeing, I think this Dr. Palan, Dr. Bhaskar Vyas, Dr. Jana, they are the legends in the history of hypnosis who shaped the history of hypnosis in India and done an influential, quite extensive, in-depth work in the field of hypnosis. And we are fortunate that we are able to interact with these legends. We are able to learn from them. And Dr. Palan, I consider him my guru-like, and I miss his teachings in my life. Still, I'm learning. With this, I thank you all. I thank the organizers for inviting me for this brief history of record of hypnosis. Thank you very much. Thank you.
Thank you so much, sir. It was indeed a very, I always say Dr. Rakesh Jain is a very good storyteller. And whenever he's teaching anything, it is almost like we are living and watching those scenes. So he took us through the galleries of the past and history of hypnosis. It was a beautiful talk by Dr. Jain. Thank you, sir. And moving forward, we have with us Dr. Alok Prappna. And Dr. Alok Prappna, sir, would be sharing myth and misconceptions of hypnosis. So if you're ready, I'll start with screen sharing and I'll screen share.
Ready. Yes. I'm ready. I'm ready.
Yes, sir.
Can you hear me?
Yes, sir. Yes, sir. I'm just starting the...
I'm ready.
Yes, sir. We can hear you.
Good evening, everybody. It is a opportunity to talk with and legends of hypnosis. My today's topic is hypnosis, myths and misconception. Hypnosis is a great science, but it is surrounded by mystery also. There are lots of myths and misconceptions about the hypnosis, and most of which are contributed by what we see, what we read in various print media, electronic media, movies, etc. Hypnosis. Next. Yes. Hypnosis is what we call as Yog Nidra or Turyavastha. Nidhi next. And it is not Sammohan Vidya. It should not be called Sammohan Vidya or Vashikaran Vidya, because Sammohan Vidya will mean that someone has cast spell on you, and Vashikaran Vidya may mean that your mind is under control of somebody else. Origin of hypnosis is ancient India. Thousands of years back, Rishi Muni used to practice it. Sushrut, who is considered to be the father of surgery, it is said that he used to perform complicated and major surgeries under hypnosis, means under hypnoanesthesia. This science was exported from India. It was re-imported with Western label, and as we know, as we know that all the Indians, they like foreign things or foreign labels things very much. So now we have started enjoying hypnosis because it is the foreign term. The clear and honest explanation is required about hypnosis, because that will eliminate the unrealistic expectation, and the persons or subjects or the patient, they will develop trust in hypnotherapists. Next. Now coming to misconceptions. I will talk about a few of the misconceptions. Of course, there are many, but at least limiting the time, we will talk about some. It is said that it is believed that there are lots of some tantric thing, black magic, jadoo, tona, or some supernatural power involved in the hypnosis. Next. But really, it is a scientifically proved therapy. And all hypnosis is self-hypnosis. Only thing the hypnotherapist can do is to guide the person in the hypnosis. And the hypnotic talent, that is the ability of a person to get hypnotized or hypnotizability, is studied in India also and in Western countries also. And as you can see that in India, high hypnotizability is seen in 20%, moderate hypnotizability is 70%, and in about 10, there is low hypnotizability. In Western countries, it is little different. High hypnotizability 5 to 10%, moderate 20 to 30%, and low hypnotizability in 55 to 70%. It may be that because we are more of, the Indians are more of heart oriented person, and Western people are more of brain oriented and very logical, and this type of person, and this may be causing this difference. The second misconception is that the person in hypnosis, it loses control over himself or herself. But in real sense, the person is having very good control. Next, very good control on himself. You must have seen artists in circus walking on the rope or doing lots of things, means they're jumping from one swing to other and all. So they are doing this, even smallest of the mistake may lead to some problem with them or injury to them. But you can imagine how controlled behavior or controlled everything is there, bodily movement, etc. And that is with the help of their control of the mind and their control of the body, and which is a part of hypnosis. Next. Again, it is believed, or it is some people think that in hypnosis the person is unconscious, asleep, or in a totally knocked down state. But the reality is, even in the state of hypnosis, the person is fully conscious, fully alert. Next, fully conscious and fully alert. Even in stage of hypnosis, he is aware what is going on, where is he, or whatever is going on around him, everything. Means we can say that he is awake, but he is resting. So it can be said that he is in a state of awake restfulness. Next. Many people come to us for hypnosis, and at the end of our hypnotic session, they say, see doctor, I was totally awake throughout this thing. I was hearing what you are telling me, and I had not been into real trance. I was sitting or lying down with the closed eyes. Means what they want to indicate that they were not in deep trance. So in that way they think that as they were not in deep trance, they were not in hypnosis, so they will not be helped. Next. But the reality is that observable depth of the trance has little, or should say no, correlation with the outcome of hypnosis. Even when the person feels that he has not gone into deep trance, the hypnosis works and it will work. Next. I will give you an example that I had been to, when one of my senior professors of medical college met me in a marriage reception, and he said, Dr. Alok, you think that you are a very great hypnotherapist? I said, sir, no question. I think I really am. You are so confident, but you will not be able to hypnotize me. I have a very strong willpower. I just thought in my mind, who the hell wants to hypnotize you? Of course, that I talked in my mind, because he was a senior professor, so I could not talk in front of him like this. But I told him, sir, it is a great thing that you have strong willpower, because in most of the study it is found out. Next, it is found out that the person with willpower, strong willpower, they have positive relation and they go into hypnosis in a much better way. Next. So, of course, he went, I gave a session to him, he went into hypnosis, deep trance, and he was definitely feeling better after that. So I used to tell him that willpower plus concentration is the something which we call better hypnosis. Next, One more misconception that hypnotist can make a person do whatever he wants. Yes, many people feel that next, many people feel that a person can be hypnotized, and in the hypnosis, the hypnotist can make a person do whatever he wants, like commit any crime. The previous one, Nidhi, previous one. So, previous one, Nidhi, the misconception of only her. So, here what happens that everybody feels that the person may commit some crime like murder or theft, or even the people feel that because I had seen, I don't know, some serial in which after hypnosis, the hypnotherapist made some person jump from the 5th floor to commit suicide. But it is not possible. Many people feel that if you hypnotize a girl, you can rape her. But nothing of this is possible. Next. Because in hypnosis, a person will not do anything which he or she would not do in a conscious awakened state. So he will not write a will on your name. You cannot hypnotize a person and make him write a will without his knowledge that he writes everything on your name. He will not do anything which his ethics and moral will not permit. He will not commit theft or murder unless he is a gunda. Like Dawood Ibrahim may commit murder even because he can do it even when he is not in hypnosis. So after that also he can do it. That is a different thing. Next. It is, there is a misconception that person can be hypnotized without his knowledge. Many persons, we read stories that a girl was going on the road and a fakir looked into her eyes and then she forgot what is that, and she just started walking behind him, behind that fakir. And when she came into consciousness, she was in some other city and she was not aware how she reached that city. But these all are bogus things. You cannot hypnotize anybody without the knowledge. Next. Because a person's cooperation and willingness is essential for hypnosis. Next. One of my fast friend who had come to me for hypnosis session, he said, "Doctor, you will give me the session and I am in a state of hypnosis. And if something happens to me, then what about me?" So, as he was my very good friend, I pretended not to understand what he is telling me. Okay, what do you mean? So he said, see, when I am in state of hypnosis and something happens to you, then what about me? I told my dear friend, even when you are in hypnosis and if something happens to you or something happens to me, don't worry, you will come out of hypnosis. Next. Because if not awakened by the hypnotherapist, unless a suggestion of prolonged hypnosis is given, the person comes out of hypnosis within 5 to 7 minutes. And generally there is very good control of the person on the hypnosis. Either he will come out of hypnosis or he will go into natural sleep. Next. One more thing that which is very much worried about the person who comes for the session. They say, oh, I may reveal certain secrets. Because everybody has some secrets and most of them will not like to reveal those secrets to a therapist. Okay. Or, sorry, earlier one. The problem is, but they, there are few people who come with their sons. One of my friend came with his son. कि Dr. Alok, do one thing, hypnotize him and try to find out. Nowadays उसका पढ़ने में मन नहीं लगता. He is not reading properly and not faring well in the exams. Just try to find out whether he has some love affair or not. This type of thing. Or was in the midnight, one of my friend's wife came to me crying and said, Dr. Alok, I know that you know hypnosis. I said, yes, Bhabiji. And what happened? No, you hypnotize your friend and find out who is that lady. And once you give me her name and you are out of the picture, उस विच से तो मैं निपट लूंगी. I said, Bhabiji, this is not possible. See, we cannot extract secrets from anybody in hypnosis. Next. Sometimes what happens that in a state of hypnosis, some encapsulated memory of some past life event may surface out into the conscious mind of the person. Of course, that is something which the person has forgotten or buried in his subconscious mind, which comes out in the conscious mind. But he will reveal if he wants to. Means, if he wants to tell to the hypnotherapist or anybody else that what he has remembered, then it is up to him. But we cannot extract without his knowledge what has come up from his subconscious mind. Next. Of course, this is just a joke that hypnotherapists should have dominant personality. But this happens. I don't have a dominant personality. My wife has. But still I make better hypnotherapists than her. Next. So there is nothing like male or female domination. All can make good hypnotherapists. Next. Next. A misconception that person upon awakening will not remember what had happened during hypnosis. Yes, this is the misconception which is partly true. Okay, this in 5% of the people, what happens that whatever has happened during the hypnosis. Next, Didi. 5% of people will not remember what has happened during that, because this loss of memory of that event or during that period, which is amnesia. Amnesia means loss of memory. It is one of the several phenomena of hypnosis. So in 5% of the case, they will not remember anything, and 30% of the people will have partial amnesia. They will say, hey doctor, in between I just used to fall asleep and then used to come out of the sleep. So that falling asleep part is the real part during which they have lost the memory, or there is amnesia of that part. But routinely about 60 to 65% they remember everything what had happened during the hypnosis. Next. So again, simple, it is altered state of awareness where there is gradual reduction of global awareness and increased focal awareness, and very calm, quiet and present state of mind. Ideas and images have greater impact. Next. Next. The hypnosis is naturally occurring altered state of consciousness. It is natural attribute to entire mankind, and everybody, all of us are capable of getting hypnotized. Next. Thank you so much for patient hearing. Thank you.
Thank you so much, Dr. Alok Prappna. I mean, the presentations are so engaging, and I'm sure all of us has benefited. All the new members who are joining this workshop for the first time, the myths and misconception part of hypnosis remains the most important part. Thank you, sir, for simplifying all these concepts to all of us. I would, our next presentation today is, I would request Dr. Palan to kindly make Dr. Yogesh Chandarana as co-host. He wants to present his own presentation. Sir, will it be possible?
Pardon me?
If you could make Dr. Yogesh Chandarana the co-host.
It is
Co-
Dr. Yogesh Chandarana's turn, or?
Yeah, he wants to be the co-host. He wants to present his presentation.
Oh yes, yes. I'll make him co-host. Perfect.
So the next
I'll
topic
take
for today would be presented by
speakers also.
Dr.
Right.
Avnish Dave. And Dr. Avnish Dave would explain to us about applications of hypnosis. So if you're ready, shall I start sharing the screen, Dr. Dave?
Yes, I'm audible.
Yes, sir.
Yeah, so you can go ahead.
Yes, sir. Just started.
Yeah, good evening all, and it's been an interesting journey for today that all of our senior members, very well experienced people have been discussing about hypnosis, and they have already mentioned about the use of hypnosis. More or less, my presentation, Dr. Prapanna's presentation was very colorful, very vivid, and because my task is to enumerate lot many things, more or less it is going to be kind of uh, uh, total, more of the presentation where you will see a lot of things, and I'll be trying to explain few of them. Conditions, but as has been defined earlier, the hypnosis has already been defined well. That it's a state of consciousness, and so its application is in every activity done by mind. I feel that wherever we use the mind, hypnosis works there. So whether it is a conscious activity or subconscious or unconscious, we don't say it as an activity, it somehow unknowingly influences our rest of the activities. So for the purpose of simplicity, we divide it into these four areas, but there are no closed compartments and there is a lot of overlapping of it. But in my practice, I categorize these things as per this so as to understand it in a little better way. So the physical health, as already we all are prominently using this hypnosis for the physical health. Mental health is another big area. The social health, which is a little ignored part, and it is likely to be the upcoming areas, and it is behind all these rest of the illnesses. If you are socially, well connected and means you are well supported, I think the mental health and the physical health are likely to remain very good. The professional health, which is nowadays a very big concern, because unless and until we don't use the word profession, people are not much attracted or convinced to listen to you. But along with that, I use the spiritual health also, because the spiritual health is behind everything what we do. And when we study about the Indian hypnosis and theory of karma, then that is how we create a connect between the spiritual health and the profession. Next slide. I'll enumerate about the various type of psychosomatic and the somatic symptoms in which hypnosis is very effective. So more or less it is going to be the listing, and I have kept it all at a time so that people can keep screening through it, seeing through it. But majority is the lifestyle disease, and we have one of such presentation tomorrow about the hypertension, use of hypnosis in managing the hypertension. Similarly, the diabetes, obesity, these are all the lifestyle disease, and they are not present from the earlier childhood. They develop as because of our faulty lifestyle, and because our priorities are different, and as a result, there is a deviation, and how hypnosis can help to reduce down the obesity, to reverse the diabetes. We have been uh, fortunate to reverse few of the insulin dependencies. We have been able to, using hypnosis, reverse the doses of insulin, and it is a very wonderful thing that uh, the hypnotic trance can stimulate the parasympathetic system, and this parasympathetic system
is responsible for stimulating all the gastrointestinal tract secretions. Insulin is associated secretion along with the other digestive secretions of the gastrointestinal tract. And with the hypnotic trance, we have been able to enhance the insulin production, and we could demonstrate the drop in the blood sugar levels. And not only that, reversing it. One case which I remember was referred to me from Reliance, one of the medical officers, and that lady was having a very fully matured cataract, and she was to be operated, otherwise the cataract would burst. And in spite of, she was diabetic, in spite of all the full possible permissible doses of medications and insulin, her blood sugar was not dropping down. So finally, some of the doctors know me over there, and then they referred that case. And after first session, we could reduce down the blood sugar from 450 to somewhere around 250, but the ophthalmologist was still not ready to operate because that is also still high. This was all happening in spite of all the full doses of permissible medicines. And then after a week, we did the second session, and then the postprandial PP2PS blood sugar, as we say, they sink down to somewhere around 150, which was very comfortable, and the ophthalmic surgeon performed the cataract surgeries, and both the cataracts were removed and the lenses replaced, and the things were done. So, beyond all the contemporary treatments, hypnosis has a magical effect, as it was said earlier. Rakesh also told that it brings really some magical, though it is a science, but the magic, there is a science behind this magic, but it really happens. And that's why the body is totally under the control of the mind, and it plays a very important role. Many of the psychosomatic conditions, bronchial asthmas, psychogenic coughing, in the pediatric cases, I see them a lot. I have been working more in the pediatric age group, and the hypnosis works much faster and more effectively in the pediatric age group as compared to the adults, because there is a they are very their hypnotic talent is high. They are highly imaginative. Similarly, the psychogenic hiccups, migraine, tension, headaches, hyperacidity, and peptic ulcers, they can be very well treated using hypnosis. Of course, the drug therapy at times is required in all these situations. Psychogenic diarrheas and vomitings, functional constipation, quite common, along with the stress, it can happen. Ulcerative colitis is very much well known amongst the high profile people in the corporates. Stresses, they also cause ulcerative colitis in small children. Cardiac neurosis, constant fear of feeling the heart attack. The muscle tightness, various types of muscle tightness, they can happen, and sometimes they can give severe cramping pain, and they can be relieved. Many autoimmune conditions, of course, in rehabilitation from the paralytic or CV strokes, cardiac surgeries, cancers, and terminal illnesses. Pediatric conditions, the phobias, childhood fears. After this COVID, online education, many of the children, when they go to school, they start feeling that, it's not so interesting. So they start developing various symptoms. Many of the parents are coming, and even after 1 year of this offline, they are still coming up with the complaints. Some of the childhood fears, sleep disturbances, enuresis, that is passing the urine in the sleep, thumb sucking, nail biting, ADHD and autism, we are able to help to a little extent initially. In some cases, we require medications. Speech disorders, to a good extent, we can handle many of them. Suppression amblyopia, which is a very rare condition we are not discussing. Dyslexias and learning disabilities. Next slide. Nidhi ji, yeah, thank you. Obstetric and gynec conditions, we use it widely. Antenatal and maternal anxieties. Dr. Dayal mentioned about smooth, painless labor. We have done this. He also mentioned, and that's an addition, that it can increase the lactation. Yes, definitely that is possible because it induces relaxation, and whenever there is a stress, the lactation may be affected. So inducing relaxation can increase the lactation, menstrual irregularities and premenstrual symptoms, sexual dysfunctions, menopause, many of the menopausal symptoms. It is said 30% of the women can have a difficult menopause, and this helps a lot. I have used it in a few cases, and it has worked wonders to reduce the menopausal symptoms. Infertility, of course, it works a lot. Many of the pain relief and analgesias. Dermatology also is the area where in some of the conditions it works very well. I have treated one alopecia areata, and the results were quite good. Surgical conditions, relieving the surgical stress, because whenever you are told to undergo surgery, naturally you are not going to be happy. The stress starts, and one of my research work was on this, where when you use hypnosis, the surgical stress, not only that, but the amount of anesthesia required during the operation intraoperatively, amount of the muscle relaxant required to relax the muscles during operation used to be less. The patient used to recover very fast from the anesthesia. There used to be less symptoms from the recovery of anesthesia, and the patient used to be discharged on an average 3 days earlier. Many of them were not requiring any painkillers post-surgery. So we had a wonderful work on this surgical stress. Treatments of burns, skin grafting, hypnoanesthesia, and hypnoanalgesia has been discussed earlier. Hypnodentistry, I cannot forget Dr. Chandarana. And while I was making this, I read one message of Dr. Chandarana, and that he immediately reminded me to add this. So anxiety of the dental extractions, he will talk more about that. Gag reflex and control of bleeding. This has been used widely as example by Palan sir in many of his workshops. Forensic sciences, it's used for lie detection and recalling of the crime scenes. There can be many applications. I may be missing many, and people can add on that. Next slide. Yeah, the mental conditions, people over here, the audience is much more well versed with the mental conditions, and they might be knowing more applications than what I am mentioning here. But from my practice and experience, I am quoting few of them. So the stress and its management, that is the first thing we are able to handle. Emotional problems, all the emotions, but major anger, anxiety, fear, they come to the regular routine practice. Hysterical neurosis, hysteria, as it was told by Alok sir. Many of the conversion disorders, we have discussed all the psychosomatic. Obsessive compulsive neurosis, this the results are very good if you use hypnosis in this. Depression, depressive neurosis, medication should always be kept in mind when we are treating such conditions, because whenever they deny the medicines, never give them kind of hope, and sometimes they want to depend on the therapist, which is a risk. That we just lost one of our very learned patient who committed suicide in spite of our repeated instructions to him to start taking medicines. He was in a depression, and he took up help, but somehow more intellectual people are sometimes more rigid. So we lost him, and he ultimately committed suicide. In spite of repeated, I have still my record with the messages that I have been repeatedly insisting that you talk to a psychiatrist and you start medicines. You need it right now, but be documented to be safe. Otherwise, sometimes it can create troubles. Post-traumatic stress disorder, corona, and the after effects of corona are still going on. We are daily getting some patients who have recurrences of the symptoms of corona they had, and we are handling them. Hypochondriacal neurosis, psychosexual problems, impotence, frigidity, latent homosexuality, conversion symptoms, there as well. Audible conflict is very less, but it can be treated using this. Next.
Dr. Avnish, Sir,
Veena.
could you be little louder? Participants are
Okay, sure.
asking for a high voice.
Sure.
Thank you, sir.
Sure. Thank you. Yeah, am I audible now? Hello.
Yes,
Yes,
sir.
sir.
Much
Okay,
better,
good.
sir.
So it is about to end only. Social health, naturally the interpersonal relationships in the adolescent and adults, these are the major issues we see in our clinical practice. People have got, connected more, but they have got detached locally more. So we are more globally connected and more locally detached from the people around. And this creates many problems, identity crisis and conflict in many of the families. These are also very common in the adolescent children. Marital disharmony, broken families, undergoing divorce, and a single parenting. This is also an issue. And as I told, that was a person who committed suicide, was undergoing divorce, and he could not handle it. He was having that stress of, depression was there, and he was not ready to accept it. Loneliness, lack of social support. This is and is going to become a bigger problem in the coming future. So, as a mental health professionals, we should be ready for it. Maladjusted personality, various types of madness and psychosis. Addictions, not only physical addictions, but the media addiction is coming up as a major issue. I've tried to contribute something in the newsletter about it, my experiences, my understanding on that. Sexual abuse is also there and is likely to rise. Next, the professional health, as Dr. Dayal sir said, incorporate whenever you are uh, uh, placing and putting this. Soft skill development in the workplace is the one which they are more attracted to. Interpersonal relations, again, there also working harmony is very much needed for the improvement in their productivity. Interdepartmental harmony, sometimes they are fighting and they are wasting a lot of time and money and productivity of the industry itself. Maintain a work-life balance. This is again a very important and a very hot thing which they are always insisting us from the trainers. Handling the work pressure and the stresses. Enhancement of the performance. Every industry wants that, to extract more than 100% from their employees. A positive attitude is very much important. Sometimes there are lots of disputes between the managements and the people, employees and employers, and that needs to be smoothed out and set properly. Healthy communication, conflict management, leadership, team building. These are the important aspects for which a hypnotherapist can contribute a lot. And then other than that, in the other areas, sport performances, many students are coming for that. Stage performances also. Then increase in the creativity and academic excellence enhancement. Sir has been running workshops since years on that, and we have seen many of the students getting a good results out of it. And I think next. So with this, I have just gone through very rapidly through the list. Many more may remain, but still in the limitations of the time, I try to conclude it. Thank you.
Thank you so much, Dr. Avnish Dave. He just ran through the lyotra of problems and issues that we common people face and wherein hypnotherapy can be used. And as Dr. Jain also says, not just in illness, but also in wellness, in performance enhancement and in personal development, hypnotherapy is of great use. Thank you so much, sir.
Thank you.
So our next presentation for the day is Mind-Body Communication in Hypnosis by Dr. Yogesh Chandarana, sir.
Thank you, Nidhi.
Dr. Palan, we need to make Dr. Chandarana as co-host. He had to log in because of technical difficulties.
Yes. Can I tomorrow screen share कर रहे हैं? Nidhi, I think I either make me co-host or something. I'm sharing my. I want to share my screen.
जी सर.
Channel मध्ये. Nidhi, is it a issue from my side?
No, sir. Dr.
Okay,
Palan is the
okay.
host,
No,
so
no,
he's
that's fine.
working on that.
Oh, okay.
He will be making you co-host, sir. So
I
in
know,
the
I know.
in the meanwhile, would you want me to share the screen of your presentation, or you would want to wait?
I don't mind. Then you go on doing it. I'll go on saying. That's also fine to me.
All right, sir. I'll start
Perfectly.
sharing.
Yeah.
I'll
Please
start
go
sharing
ahead.
your
So
presentation.
we don't waste our time.
Yeah.
Okay. So good evening, everybody. My stalwarts into psychology, psychiatries, and hypnotherapy, along with my all respectable teachers. My topic is mind and body communication. Next, Nidhi. Okay. As we know, our basic logo of our Academy of Hypnosis is health, harmony, and happiness. So it is something where we must know that how hypnosis, all our previous speakers have said how the hypnosis is born in this world, how the hypnosis is born in India, how and what are the misconceptions. Dr. Alok mentions about all that. Even Dr. Avnish has said where we can apply. But how that hypnosis happens, or what is the basic connection between mind and body? Either you say connection or you can say communication. Communication is basically, we all know, is a two-way process. So it is sometimes said since ancient time, the researchers, philosophers, and all the medical people have tried to go in depth of mind, and mind has still remained a mystery, but that mysterious mind is of utmost importance and can be made use through these wonderful science of hypnotherapy. So mind and body is not just one-way communication. It's not either psychosomatic we normally use, but not somatopsychic, something like. So is it whether the mind is first or body is first is a debatable issue, like a hen first or an egg first. However, if we go beyond that into a world of spiritualism, they say that every birth you get a new body and a new mind, a new brain, but your mind is an eternal thing which cannot be separated from you unless and until you are enlightened. Of course, that is not a topic of today to communicate, but that search of how the mind is, where the mind is again a most debatable issue. But one thing which everyone has come across to settle down, that it's a coexistence of mind which operates through brain. And we can say in a language that mind is a software and brain is a hardware. Of course, unlike the word I use, a software not available in the market, which you can push into you. But I would say, yes, it is available in the market through hypnotherapists, and you can make use of this software as a mind through hypnotherapist and can operate through hardware of your brain very well. Next, Nidhi. We all know one thing which is very certain for understanding what we are, how we are. We are all the byproducts, or all our personality is byproduct of all the communication done to us in past till present. And we try to perceive the world through all these five senses. However, we know that these are the external sense organ. These are the external sense organs. And if there is any defect in its perception or perceptible level, then whatever the sense you perceive is not perfect. However, what is more important to us in life is a perception. Next. So perception is something how you see, what you see, and a perception makes our world. That is the one which is how we see. So whatever we see, the brain is the main organ as a body part. You can say very important organ that tries to correlate the whole situations and tries to make sense out of it. So we'll see in detail with various examples. So to understand this, next, we need to understand how we experience. So mind and body connections can be well understood with any experience of life or an event. And any event with a perception is making our experience fully. So we assign meaning to the things through these experience and observations. So let's take example. Next. How the experience can be divided into its component. So that has two components mainly, as we all know. One is psychological component and the other is biological component. Psychological is further divided into perception, then affect, feeling, cognition, that is thinking, and cognition, that is decision and planning. Whereas biological is sensory perception, motor perception, and the three various aspect is ANS, autonomic nervous system, endocrine, and then is the third one. So knowing this, as you know, that if you want to know anything in detail, we need to dissect. And as a medical doctors, as a physiologist, our president of AOH does everything with a wonderful correlates, knowing the physiology of every aspects of hypnosis. And I'm really thankful that for making this, what I learned from him about mind-body connection is a wonderful thing, which we'll see by taking a simple example. Next. We normally, as a human being, have two types of reactions or responses. Please wait. Nidhi, please wait. Nidhi, please wait. Nidhi, please wait. Here we are talking of simple one example of Mr. A and Mr. B, where I can say when Mr. A was passing through the market, we want to know what exactly is the thoughtful response and what is the impulsive reactions, and how mind and body is connected for both these responses. So while Mr. A was passing through the market, he heard a sound, it was a very loud sound, and he recognized it as that of an exploding bomb. So he felt frightened, and he thought his life is in danger. So he wanted to have a shelter, started perspiring with increase in pulse and respiration, and started running around looking from side to side for the shelter. Now this is just, we are enumerating one incident or an event. How this event can be classified into a psychology and biology part of it. So first one, that while he was passing through the market is a motor movement. He heard a sound is a sensory perception. It was a very loud sound, that is in-depth sensory perception, and he recognized it as a exploding bomb. That was a thought. So that is next as a psychological perception. And no sooner he recognized that he was frightened. So that is what is next. Yes, affect or feeling. He had that emotion of fear or frightened, and he thought that his life is into a danger again, which is a conation. Next, Nidhi. A thought, that he thought that his life is in danger and he wanted to get a shelter. That was a decision, then he made it. Out of a thought that his life is in danger, he was looking for it took a decision and was trying to find a shelter. And all these, or during all these, he started perspiring, his pulse and respiration increased. Next, Nidhi, go ahead. Nidhi, next. Yes, and he started running, looking from side to side is again a motor movement. So here it is all the thoughtful response after he got a sound of blast of a bomb, when he recognized that as a blast of a bomb, whereas we will see how the impulsive reactions are made into Mr. B. Mr. B also was passing through the market. He heard a sound. It was a very loud sound, and he recognized it as an exploding bomb, and he felt frightened. The next. No sooner he felt frightened. No. We are still. He just froze and couldn't move, and he ran in the direction of a blast. See, both the people had same biological, same perceptions. However, the one who gave a thoughtful response and the other who got froze gave an impulsive reaction. Now, to understand this into its more detail, let's see how this all happens in a brain. However, my presentation takes 15 minutes of time to explain you, but everything happens in brain just in few seconds. So we will see how the brain behaves or how the brain operates these psychobiological responses. Next. This is a picture of a brain where it is divided into the various lobes having different kind of functions. If you see here, it is the back part of the brain, which is known as occipital lobe, which carries out a very important function of seeing and reading the data and everything. That means learning. This second part, which you see here, is an area which deals with hearing and listening. The one small part that we all see here is a area of feeling and emotion. So you can say it is a limbic area where all the emotions and feelings are stored and executed. This is the frontal lobe of the brain, which carries out very higher functions of thinking, speech control, decision, and planning. However, this area of brain is a very important area which carries out all the movements of the body, that is known as motor area, leading to a behavior. Next. So we see how impulsive reactions versus thoughtful reactions happens into a brain. Next. Exactly. Now, when we are born, we are all born with a limbic area which is directly related to the motor area. And that motor area is responsible for any behavior in us. So as a child, with anything that this is the only circuit, which is the shortest circuit in the brain, which we all have right from our birth, childhood. And this is having, next Nidhi, with two neurons. Yes, that is one from limbic system to motor and from motor to the behavior, meaning thereby we are highly impulsive to express any feelings that comes with us. Commonly, if you see, whenever we are frightened or feared, we cry. If we are angry, we throw away the things and shout. And if we are happy to see anything, we just pick it up. So this is how we are born with. And these are the only two simplest circuits, or two neuron with one synapse circuit in brain, which is very, very important as a impulsive reaction. However, as we grow in our life, we come across number of people around us, our parents, our teachers. We all listen to them, we all observe them, and then slowly, this is the area which is a big area known as Gnostic area, where the knowledge and wisdom is there. So slowly, we start gathering the informations by listening and then by seeing and reading. Next. Nidhi? So by that is, just wait one, yeah, go one back. So from seeing the behavior and reading, also we gather the knowledge and wisdom with values in life. And we slowly start getting mature. So as we grow, next, from this limbic area, there is always a new connections which are developed to the thinking area. So any emotion, when is generated or is felt, it immediately consults the thinking area, which in return consults, next, to the Gnostic area. So what I call in a language of psychology, this Gnostic area, which is the frame of reference to our mind. And we just try to get the reference and find a meaning out of any information that we receive or any emotions that are generated, which in turn, next in the from Gnostic area with the wisdom and knowledge of references, it goes to the thinking area back. And in this case, for the case of Mr. A, which we talked about, the Gnostic area conveys a message that in such circumstances, you should not be feared, you should be having a courage and confidence. So, no sooner that message goes to the frontal lobe of thinking area with the message of courage and confidence, this whole idea how you should be going further in these incidents. Next, these thinking processes which are given as a direction from the Gnostic area to frontal lobe, it goes to the area of decision and planning. Next, Nidhi. Yes. So from this thinking area, it is diverted to the lobe where there is a decision and planning. This is the area where a person or the brain immediately analyzes how fast he should move, in which direction he should move, which type of muscles should be used, which should be contracted, which should be used first, and that whole blueprint of the further movement of action is given to the motor area. Next, Nidhi. And once this blueprint is provided to the motor area, it results into a behavior. Now, this is one of the most complicated circuit out of two that we have seen, and that is the thoughtful response. Now, from childhood, as we all know, we are just working with a short circuit plans. So we have impulsive reactions. However, when someone comes or when we are calm and comfortable, we are going to use this long circuit of thoughtful response. But mostly it is only when someone comes and asks an advice, we are advising like this. But when the incidents like this happens, we are also generating that fear, and thereby immediately we use this short circuit of impulsive reactions. Now, in addition to the response from Gnostic area to frontal lobe, that you must have confidence and courage, the next part of the brain, Nidhi, next. Nidhi, yes. This goes to the limbic area and says that you must have courage and confidence, which initiates next to the hypothalamus. Next, yes. Hypothalamus area, next, which is a part of limbic system, and it is the one which operates through that hypothalamus area for three things, that is our ANS, that is autonomic nervous system, next, endocrine system, and immune. So this limbic area sends a message to the hypothalamus that what kind of energy is required through secretion of what endocrine glands, and how more immunity is created or energy is created for immediate behavior in brain. So, as I said, this is the impulsive reaction versus thoughtful reactions. Mostly, we are used to use the impulsive reactions only unless and until we are calm and comfortable. So where the hypnosis comes in this place, hypnosis, as we all know, by providing auto suggestions, by making use of SIC, we can make person use more of these thoughtful responses and not use the impulsive reaction. So this is the whole process which we have seen in these last couple of minutes, but it all happens in fractions of second. And with use of hypnosis, we are able to positively develop a thoughtful response. Next. So to summarize, in short, that without going into the jigglings of everything in much detail, don't mind. If you want to be happy, don't mind unless mind minds you. And the best way of happiness or towards happiness is don't mind when someone else minds, only mind when your own mind minds. It is mind which matters and it is the body which bothers. But that both things goes parallel together, that whenever you are not well or comfortable, you are not going to have a sound, relaxed mind. Thereby, it doesn't operate through the circuits which it should. So we can say sound mind has a sound body and sound body has a sound mind, which we all celebrated 2 days back, World Yoga Day. So yoga is one thing where we claim that we train body and mind together. However, hypnosis is still much more simpler science which can be used in our day-to-day life. Next, with these few words, I thank you all for listening to this most complicated subject of physiology, which is made simple to me, explained by Dr. Palan. And if anyone is interested to see the wonderful video prepared by Dr. Palan on the same aspects, it is available on Samatvam YouTube channel. And I really and sincerely thank Dr. Palan, my guru of hypnosis, who has made this complicated circuit simple by putting me into a trance. And now I am sure which he will all again going to put all of us into that trance state to make this still more clearer to all of us. Thank you very much. Thanks. Nidhi, that's fine. I'm done.
Yes, sir. Yes. So thank you so much, sir, for going through such a complicated topic in such, I mean, the presentation was so beautiful. It was as if we are all looking at the actual brains, three-dimensional effects. Thank you so much, sir.
Yeah.
So the next topic of our presentation today is the phenomenon of trance or trance-like phenomena, which will be presented by Dr. Prasanat Roy. So if you're ready, shall I start by sharing the presentation?
Yes, thank you, Nidhi. Whenever we talk about hypnosis, a particular word come again and again in our discussion, that is trance. And there are lots of debates about what trance is, whether trance effect really present, or there is something else that can explain the trance. But if you look at the classical understanding of trance through hypnosis, where it says that it is a temporary mental condition in which someone is not completely conscious of and do not have any control of himself or herself. That is the classical understanding that started with James Braid, and that's how we conceptualize trance. And here the controversy lies in this definition, because the concept called the control is there. where the person may not have the control of himself or herself. Later on, Milton Erickson, who clarified these concepts of trance with a newer definition, where he mentioned, Milton Erickson is one of the famous hypnotherapists, and there is a school of hypnotherapy in the name of Milton Erickson. He has contributed a lot in various psychotherapeutic modality, and he has mentioned that trance is nothing but a narrowing and focusing of the person's attention, so that they are more aware of some things and less aware of others. And this is important thing that Erickson has mentioned. And that's how we now understand hypnosis with enhanced focused attention. And because of the enhanced focused attention, we will hit something and we will be able to ignore many of the things. As a result, there can be more therapeutic effect in the individual. And here the concept of control, the person is going to lose control, that concept is not at all there. And again, the concept of whether person is going to have full consciousness or not, that was there in the classical definition, that is also being refuted. And here Erickson mentioned that the loss of consciousness is not necessary to experience the trance state. And he was the person who started talking about trance is a everyday phenomena. In every day, every activity, every psychopathology, we experience some form of trance. But in this trance concept also, we can see that there are natural state of consciousness that includes rapid eye movement. That is typically there in the older theory of trance. And hypnosis is used as a mean of bypassing the conscious mind and facilitating the trance, so that problem resolutions can take place on an unconscious level. So that is another, the classical understanding of hypnosis, where the trance is being used as a therapeutic technique. Next. So when we talk about this everyday trance phenomena, as explained by Milton Erickson, we need to understand that trance phenomena is being the means by which symptoms are also created and maintained. And that is the part of the trance phenomena. For example, when person is suffering from anxiety, what the person is preoccupied with about the future, the fear of future. I'm going to lose my job. There can be something bad can happen. My health, I might develop some severe health condition. I might not get a chance in a good academic school or college. So what happens there also, the person is continuously focusing on the future aspect of the life related to danger, and discarding all other information that with this much of past, the persons can get admission in this college or this school. With this much of academic background, these are the job opportunities person might have. So we are discarding those things, we are ignoring those things, and we are focusing again and again on the future. So that is also kind of trance phenomena. And that's why we talk about negative hypnosis in development of many of the psychiatric conditions, be it depression, be it anxiety, be it experience of pain, where the primary focus is on that particular negative experience, and the person is too much preoccupied, too much into trance state to that particular experience. So as there is a negative hypnosis or negative trance phenomena involved in the development and maintenance of psychopathology or any kind of suffering, so that's why same trance phenomena in a positive way can be used to deal with the negative hypnosis. So positive hypnosis will substitute the negative hypnosis phenomena so that there is a recovery or decrease in the symptomatology in the individual. So that is part of the deep trance phenomena that the hypnotherapist use commonly in the treatment process. But if you look at the lighter level, where on every day some of the common everyday trance that we experience, for example, scrolling down the Facebook or YouTube without realizing the time, maybe at night at around 11 or 11:30, we thought, okay, within 5 minutes I will go to sleep. So let me just check this particular updates in my Facebook page. and all of this, and I started scrolling it down. And after 20 minutes or 30 minutes, maybe after 1 hour, I'm realizing, oh, so many hours have passed. So I was actually in the trance state. Daydreaming is also a kind of trance state where we lose the track of what is happening now, and we go into some fantasy. Even when you create some kind of vivid imagery of the places where we had visited or some ceremony, that also involves a trance state. And awareness of the environment suspended during this particular experience of everyday trance phenomena. Like when I'm presenting this particular topic, what is happening around, if someone is uh, calling me or not, if there is a phone call is coming or not, all those information have been suspended. My awareness is completely focused on this. So that is also a milder form of trance state or focused attention state that we are engaging into. And even while listening to the old songs, many a times what can happen that we start remembering some of the past experience. And maybe a old romantic song, the person can start thinking about the childhood love affair or something else. So that is also a kind of going into automatic trance phenomena. And or maybe when I'm driving, suddenly I'm realizing there is no memory of the road that I drove for a while. So all those are experiences where some dissociation is happening. I'm losing the track of the thing, though I'm not committing any mistake. So there is some amount of awareness present, but I am not aware about that awareness. So these are all experience of everyday trance that people are already using. Even there is a concept called alert hypnosis. In the sports people, they frequently use it, where they have to be too much alert. And in that alert hypnotic state, there is a extensive trance state in the individual, and they are highly focused. They even the audience, what audience are shouting about, they bypass everything, and they are completely focused on the activity that we're doing, and they do not even realize whether they have passed 1 hour time, 1.5 hours time, or 2 hours time, or 5 hours time into that play activity. So all these are some of the examples of everyday trance phenomena. Next. Even we can experience trance phenomena in some of the hit moment, like watching a cricket match last over with 50-50 chance of win of your favorite team. And what we experience is we do not listen to the name calling or phone ring or calling bell. And sometimes thinking about the problem again and again. For example, I might have witnessed something negative on the road, might be an accident, and thinking again and again about this particular experience. That is also a kind of the trance experience people are having. So some of the trance phenomena are helpful. Some of the trance phenomena can be harmful, and some of the trance phenomena can be just normal, common day-to-day experience. So we need to recognize what are the harmful trance phenomena, negative trance phenomena, and how to modify that negative cycle into the positive cycle, so that the desirable changes can be brought. And hypnotherapy is a modality where this trance phenomenon is constructively, metaphorically, positively used to experience the positive aspect of the life. Thank you. I've completed.
Yeah. Thank you, Dr. Prasanta, for explaining to us in such simple words what everyday trance phenomenon looks like, because there is so much mystery shrouded around this that we need a special preparation to get into trance. Turns out we enter this state of trance many times in a day. Thank you for explaining it in such simple words. So going forward, now that we have spoken so much about the phenomenon of trance and hypnosis, why not experience it firsthand? And who better than Dr. Bhupendra Palan himself to take us into this beautiful journey of trance? So please.
Thank you. Thank you, Niti. And thank you, all my colleagues. every one of you did wonderfully well. So my job is very simple now. All the people now know that there is nothing going to be like a magic, and whatever you are going to do, you are going to do by yourself. I am not hypnotizing you, and I believe that no one can hypnotize the other person, but you can definitely go into the hypnotic state by yourself. My job is just to guide you. So what will happen is guided self-hypnosis. You're doing your self-hypnosis, but many of you do not know how to do it. So you will use my guidance and go into your own hypnotic state. And then I will guide you how to be again in a waking state. And going into that and coming out of it is just like just now Dr. Prasanto told that while you are watching some interesting movie or a show, you get into it. You may become a character in that story. And then when the show is over, you again come out. So going in and coming out is not something very unusual. It happens in our day-to-day life. So it's going to be like that. It's relaxed awareness. So while your body would be relaxed, while your mind would be relaxed, you have awareness about something. Now, the guidance which I'm going to give you, it will involve three things. Initially, I'll guide you to be comfortably seated, relaxedly, and being aware of your breathing. So you will start with being aware of your breathing process as it is going on, natural breathing. Then after a while, I'll guide you for body relaxation. So you'll put the different parts of your body in a relaxed state. For putting it in relaxed state means leaving complete weight of those parts of your body onto the support. So when I say let your legs be relaxed, you will put the weight of your legs onto the support, on the floor, on the chair on which you are sitting, like that. And the third component of induction process is going to be imagination. I'm going to ask you to imagine something. Now, imagination could be of three types. You may think. Thinking is also a kind of imagination for psychology. So suppose I want to imagine a garden, I may just start thinking about a garden. There may be many trees and plants and flowers and butterflies. So whatever is there in the garden, I may just think about it. Now, while thinking, some of you may start visualizing. Whatever you are thinking, you are seeing in front of your mental eyes. That is called visual type of imagination. And some of you, while visualizing, may start experiencing that. It is called experience type of imagination. So not only you are seeing the garden, but you may hear the chirping of the birds, or you may have the fragrance of the flowers, like that. So it may be thinking, it may be visualization, it may be experience, and whatever is there, it is perfectly fine. It's not that experience is better than thinking. They are same. So depending upon your hypnotic ability, you will be going into that trance by using this guidance. And I think many of you are already in hypnotherapy and you know it, you have undergone it, and you have been guiding other people also. But people who are new to this science, they may have this kind of experience perhaps for the first time. So it's very simple and you are going to do it for yourself. I'm just going to guide you. With this, if any one of you feel like drinking little water, you may take little water, because in this kind of experiences, there are chances of decrease in your salivary secretion, and that may create little dryness in the mouth, which may disturb you. So you may drink a sip of some water And if someone of you want to use the washroom, may quickly go and come back by the time I give some general instructions. So you should be physically comfortable. And then you may like to have a comfortable position also, like the chair on which you are sitting, you may slide little forward to let your feet be placed comfortably on the floor. Let your back be supported on the backrest. If you have a headrest in your chair, you can put your head on the headrest. Or some of you may like to go on a sofa or on a recliner. So whatever is comfortable to you. So make this arrangement. I'll give you a few seconds for being more comfortable. So let me give you a minute, 1 minute for preparing yourself. Okay, so I think we are already in a comfortable position. You will do as per my guidance, whatever you can do, whatever you can't do, just don't force yourself to do what I'm asking you to do. And suppose I am asking you to relax some parts of your body, and if you are unable to relax them, it's okay, like leave it. Suppose I am asking you to imagine and you are not able to imagine anything, it's fine. So, see, then sometimes I say that inner life, something if I want to achieve, I need to make efforts. And since my childhood, I've been told that make more efforts to get better outcome. So study very hard, do very hard work so that you get better outcome. So we have learned how to do efforts for achieving something. This state of trance is the only thing, self-hypnotic state or meditative state. It is called meditative state of consciousness also. It is the only thing which you get by giving up all your efforts. When you don't do any effort, then you will automatically go into the state of trance. So what I am really going to teach, or what I teach to my clients, is how to give up your efforts. So don't make efforts. ठीक है, आसानी से जो हो सकता है वो करो, नहीं हो सकता है उसको मारो गोली, जरूरी नहीं है वो करने का. तो इस तरह से बहुत रिलैक्स्ड वे में करना है. So make yourself comfortable on your seat and keep your eyes gently closed. Your eyes gently closed. If it is necessary, you may move to make your body even more comfortable. And be aware of the process of your breathing. Your normal, natural, spontaneous breathing, which is going on all by itself. Simply be aware. Just now, you know that your eyes are closed. And for knowing that your eyes are closed, you don't require to concentrate. Without concentration, you simply know that your eyes are closed. That knowing is being aware. Knowing is being aware. So you are aware that your eyes are closed. Exactly in the same way, you know that the breath is going in and the breath is coming out. Just know this thing. You need not to concentrate. And see how your body is relaxing every time while you are breathing out. You know, our body would relax while we breathe out. See how both of your legs are resting limply, loosely, comfortably on the support. If necessary, you may move around your legs and make them more comfortable, resting on the support. Think about, imagine waves of relaxation and comfort starting from your legs, spreading up, encircling your stomach in the lower back, chest in the upper back. Waves after waves of relaxation and comfort, encircling stomach in the lower back, chest in the upper back. And all the muscles of your trunk are relaxing more. While the trunk muscles continue relaxing, be aware of the relaxation in your arms. You are leaving complete weight of your arms to rest on the support, loose and relaxed. दोनों हाथों का पूरा वजन सपोर्ट के ऊपर आराम से छोड़ दे, मुक्त छोड़ दे, ढीला छोड़ दे. And see how your neck muscles are relaxing. With relaxation in the neck, if your head is drooping, you may allow it to droop and let go. Let go of all the tension and tightness. Let go of all the stress and strain and simply relax. Simply relax. And see how beautifully your face is also relaxing. So the whole body, right from the tips of your toes up to the top of your head, every muscle, every joint, relaxing more and more. While your body may continue relaxing more, my voice is talking to you there in the depth of your subconscious mind, all by itself, effortlessly. And in this relaxed state of your body and mind, you may now like to go and visit some beautiful, enjoyable place where you had been in the past and enjoyed a lot. Or perhaps it could be just an imaginary place. So imagine yourself in some beautiful place. It could be a beach, it could be a river bank, it could be a mountain top or a waterfall. It could be a forest, it could be a beautiful park, wherever you like to go. Imagine yourself being there. You may see and hear, feel, and perhaps even smell all the beautiful things which are here in the world of your imagination. And you know, as it happens in a dream, sometimes 2, 3 places may combine together to make a wonderful place for you. Or perhaps like a dream, you may fly and float from one place to another and from there to the third place. Whatever is happening, let it happen. Whatever is happening, let it happen. And just be with it. Enjoy. You may be all alone in the beautiful world of your imagination, or there may be some people with you whom you may love to be there with you, your family members, your friends. You may seek to rest and relax here. You may move around and explore the beauty of the place. You may sing and dance. You may play, whatever you feel like in this beautiful world of your imagination. You may call this as your serenity place, where you feel calm and serene, where you feel happiness, joy, where there is absolute sense of security. It's your serenity place. As you are enjoying in the world of your imagination, you may collect all these beautiful feelings in your heart, joy and serenity, peace and tranquility, motivation and enthusiasm. इन सुंदर भावनाओं को अपने हृदय के अंदर भर ले आप, शांति और सलामती, आनंद और प्रसन्नता, उमंग और उत्साह. Collecting all the beautiful feelings in your heart, you may fly and float and mentally drift back over here. Mentally, you may drift back to the place where you are. Body is resting, relaxing comfortably. Eyes are gently closed. And my voice is talking to you there in the depth of your subconscious mind. After having enjoyed this beautiful experience of trance, you may now feel lightness in your eyes, comfortable sensation of lightness in your head, waves of alertness and energy spreading through your body. शरीर में जब स्फूर्ति, चेतना, जागृति की तरंगे महसूस हो, आंखों में जब हल्केपन का एहसास हो, अपना योग्य समय लेकर धीरे से आंखों की पलकों को खोलना है. Taking your own time, very slowly. If your head is drooped, you may make it gradually, very slowly straight. You may like to take a couple of extra deep, refreshing breaths while your eyes continue feeling lighter. Slowly and gradually, as and when you feel like, you will open your eyes. You may like to have little movements in your fingers, in your toes, and in the feet, moving your body, and then you may like to stretch your body. Stretch your body to be perfectly wide awake, feeling good, feeling refreshed in your body and mind. Okay, I request all of you, those who are able to put on your videos, please, if your Wi-Fi permits, प्लीज पुट ऑन योर वीडियो. आपके दर्शन करना मुझे बहुत अच्छा लगेगा. आप प्रकट हो जाइए मेरे स्क्रीन के ऊपर, जैसे भगवान प्रकट होते हैं ना, ऐसे आप सब प्रकट होते हैं. मुझे बहुत अच्छा लगता है दर्शन करना आपका. तो वेरी नाइस, गुड. So this was an experience. This is called self-hypnosis. You did self-hypnosis with the help of my guidance. In the same way, you can do it by yourself also after some training. This is called neutral self-hypnosis. It's like putting on your computer, keeping it on for some time, and then putting it off. But then after putting on your computer, you want to do some work. So how to do that work? That is what we teach the client in hypnotherapy. So for being a hypnotherapist, you need to be a therapist first and then learn hypnosis as a tool. It's not that you learned this thing and you became a hypnotherapist. So ये एक साधन है. Trance is a tool by which you can achieve some goals of physical health, mental health, social health, spiritual growth. So that's all about this experience. And we have some time, Nidhi, जो general time है discussion का है 8-10 minute.
So yeah, if we can take few questions and then
Yes.
we'll move to vote of thanks. So candidates may just raise their hands if they have questions about today's session. And thank you so much, sir. It was like 10 minutes of absolute bliss.
Thank you. Right. Yes. So hand raise का icon आप करेंगे तो यहाँ ये first screen पे आप आ जाएंगे. So those who want to give some comment, some feedback or question.
Yes, sir. I think we have our I see Mugdha's raised hand. Mugdha, yes, please.
Hi, sir. Good evening. Good evening, everybody. I was your student last year, and I've been freelancing as a hypnotherapist now. So I had one client. So there was this experience that she had that I took her into a trance, and she did not remember anything. Even during the trance, she woke up, opened her eyes, looked up, and then went back. And I thought that her trance is not deep and all, but she did not remember anything once she came back. I mean, once the trance was terminated. So, she didn't remember anything about the session also. So, in such cases, should we repeat the session and or should we like?
Mukta, I would wish that you start coming regularly for those AOH clinical meetings. And this is a question for that clinical meet rather than here. It's a very, very preliminary introductory workshop for those who do not know about hypnosis. So please join. Do you get that? Do you know that we have monthly
Yes,
meeting?
yes. I do
So
join sometimes.
come in the next meeting and let us discuss on this. My answer to you just now is it was a therapeutic session and you need not to repeat the same session. Those they do not remember. And then you need to observe. So it was amnesia during trance, and amnesia can be there even in a moderate level of trance. You don't require very deep trance there. But then let us have this is the kind of discussion which is, will make our clinical meet more lively. So please join that.
Sure, definitely.
Yeah, please.
Yes. Thank you, Mugdha, for this question. Do we have any other questions from other participants? You may put your question on the chat box, or you may just raise your hands here.
Good. So there are no questions. It means
No more,
everybody has
no more further
understood
questions.
everything. That's very good. There are two meanings, but I take one meaning only because it is empowering for me. So disempowering wala meaning मैं नहीं लेता हूँ. So very good. So now we proceed further.
Yes.
Nidhi?
Yes, sir. So this was end of today's workshop, and I would now like to invite Dr. Avnish Dave, General Secretary of Academy of Hypnosis, for vote of thanks. And before sir takes off the stage, I would I'll make this announcement that today's newsletter will be uploaded on the website of Academy of Hypnosis, and it will also be shared on our WhatsApp group. So by tomorrow, it should be available to all of us. And there are a few participants who are going to join us even tomorrow for the advanced level workshop. We'll see you tomorrow morning. Dr. Dave, we can proceed with vote of thanks.
Yeah, so coming to the end of the meeting, but a new beginning. We are really happy.
So a little louder, little louder.
Yeah. So we are really happy to have this occasion today, which we celebrated last year. We started with our first step, and we have already crossed 1 year. And for the years to come ahead, we will see that we keep on contributing more and more to hypnosis and to bring the hypnosis into the mainstay therapy and try to brush up all the myths, all the reservations, misconceptions people have about it, and take it up as a first step therapy. And that is what is a dream of our all beloved Palan sir. So we are all the warriors of that group, and we are really very sure that we are going to achieve that goal. And I am thankful to all the speakers, the participants, for making this event a really successful event. Thanking you all once again.
Thank you, Avnish. Thank you, Nidhi, and thank you all.
Thank you, everyone.
We close the session.
Yes.
Okay. Bye.